about us.
And hello. How is everybody tonight? Welcome to the Performance Medicine Show, our live Q&A we do every single Tuesday. I see we've got some people already in the chat. What's going on? I see Debbie from Australia. Tom, my brother, what's going on? Great to see you. Roel, what's up, man? Great to see you from Texas, as always. So glad everybody is in here tonight. If you're with us already, let us know. If you're new to the show, let us know where you're from. I'm going to do this for our team. If I could find it, there we go. And this will change a little bit because we're getting sophisticated. Tabitha, what's going on? Great to see you. Angie, hello. Oh my gosh, the crew from Up Front and Kingsport is with us tonight. So good to see you. I can't wait to see you guys in person. I'm going to be up there next week. Get to hang out a little bit. Rachel from Johnson City, what's going on? What is going on? Carter from all the offices, what's going on? I believe I'm going to see Carter tomorrow here in North Knoxville. Can't wait to see you guys. We've got a great crew coming in. Doc is on his way. Linda, I love you. So good to see you. D. Lynn, hello. I'm glad you're back, D. Lynn. Thank you for being with us again. Let's see who else is in the building tonight. Can y'all hear me okay? Everything good on my end, tech wise. Tech is, a little down the list of my specialty. Luckily, we have a great team behind the scenes. I'm looking at them in the green room right now. Thank you for getting us set up and going. My brother Steve is in here. Steve, what's going on, my man? So good to see you. All right, thank you, Tom. Thank you, D-Lynn. Stan's in the building. Stan, what's up? I'm excited about tonight, as you guys can tell. It's a fun week for all of us. We're heading into Thanksgiving week, and you can see we've got a bunch of our team in here tonight. The biggest week of the year at Performance Medicine is next week, the 25th through the 29th. It's our Black Friday specials. I'm going to be talking about them throughout the evening, most likely. We've got our deepest discounts on all of our stuff all throughout the year. You'll hear me put this up throughout the evening and throughout the next as well as next show as well, because it's happening all week. It's not just Black Friday. It's, as you can see there, November 25th through 29th. So stay tuned. We're going to be bringing that up. If you guys have any questions, our team is a lot of our team is in here tonight. Can answer anything that you guys have about those specials. You know what? I'm just going to put this up here. Katie's, it's her favorite week. And I tell you what, she is working night and day this week and next week, putting this all together. I want to give a huge shout out to you, Katie, our COO, for getting this together, making this run smooth. We've been doing this for the last, 13 years. And it's our biggest volume week of the year. So we get tons and tons of phone calls, tons of emails, tons of traffic through the offices. And Katie has really done an amazing job making sure everybody gets what they need. So Katie, we love you. Thank you so much for everything. And this and next week especially, she's working her butt off. So thank you so much. Thank you to all the team. We're going to have such a great time. Hopefully the offices will be filled with coffee and joy, all the above. No carbs though. No carbs. Is Doc ready to roll? There we go. Ivy, what's going on? Great to see you. Is Doc ready? Doc is ready in the building. All right. Let's see if I can get him up here. What's up? I see.
Ben, you can't say you work your butt off on TV. Can't say the word butt.
But I'm telling you, this month really is just a whirlwind for us, and and everybody's working super, super hard. And I know what Katie has done to put this all together. So I wanted to give her a shout out in front of everybody tonight. It's a really
She
special
works hard. She
call,
works very, very hard.
and
I thought you got a haircut, man.
I did not. Well, I did. They say it's like shaping it.
You need to get
It's
your money back.
well, no, I'm not going to, because D. Lynn likes the long hair.
Does D-Lynn like the long hair?
D. Lynn likes the long hair. So there we go.
Okay. Well,
but
okay.
hey,
Yeah, I got my same shirt on. This wasn't even planned, was it?
look at this.
Yeah, this was not planned. I just
tell
came
you what.
home and got out of my dress shirt and put this sweatshirt on.
Can you guys tell
You
that
think
we're
what?
father-son? If you guys are new to the show, this is a father-son show, and every once in a while you can tell. Like, if I were to shave, I would probably look a little bit more like you.
I need to usually wear a ball cap, don't you?
Yeah, but my grandmother might be in here, and she is getting on me about letting the locks flow, and so I am I'm letting them go tonight. I'm letting them go.
Some people have asked me what that phrase means on the shirt. I work for patience. Can you explain that to people?
Oh man, honestly, this is my favorite shirt that we have. Katie and Carter can attest to this. When we saw the design for this one was like amazing. But I work for patients. I believe all of our staff has this hoodie, and it goes back to the fact that we don't take insurance and we work directly for the patient, and which is unfortunately a rarity in healthcare. But I love it. I love it. Whenever we talk about, working for patients, I think, that's what we're doing tonight on this show, is we're working for you guys here in the live chat, for you guys listening on the podcast. We're doing whatever we can to make sure that you guys feel educated and know the right questions to ask, and things that you can do. How would you define I work for patients?
Yeah, we have more time for patients. We don't have to fool with all the bureaucracy and red tape of coding for insurance companies, hoping that they'll pay us, trying to run the bill up so we'll get a third of what they're going to bill for. It's just, I did that for many years. I had to, because I worked in a large group, but it's a better practice. It's better for the patients. It's better for the doctor and the providers. It's just better quality medicine. It takes all the middlemen, red tape, hassles out of trying to help the patient. So, if I didn't do it this way, I would not be practicing medicine.
Yeah. Yeah, I believe that. I remember, it's funny. I remember those moments like it was yesterday, kind of when you're going through the process of starting performance medicine. Is super cool to kind of look back on. But man, it's such great conversation here in the comments. I can't help but, Jeff, I see you. What's going on, man? Great to see you. I love this. I love, Katie not only works for the patient, but she works for Dr. Rogers as well.
Just remember that. Yeah, Katie,
I love that. And whenever we need to, Dr. Rogers, we can change that into the supplement brand as well. I see. Okay, Roel, I see you. That's a great one. If you guys have questions for Dr. Rogers, go ahead and put it in the comments. We're going to get to every single one today. We had a few come in throughout the week. We appreciate you guys for getting us started off on the right foot. If you guys are new here, let me know where you're from. Let us know you're new. If you're a regular, give me a what's up. Give me a high five. We're going to have a great show tonight. Doc, you ready to roll? All right, let's rock and roll here. I want to pick this back up because it was a topic that I know a few of our team gave suggestions around where to get it. I'm going to put it back up. Back to the colostrum talked about last week. I read one thing that says if taking it, that there is no need to take collagen also. Do you agree with that? So the question is, if I'm taking colostrum, do I need to take collagen as well?
Yeah, I'd still take collagen. They work in different ways. I'm not sure if there's how much collagen is in colostrum, to be honest with you. But, colostrum we use more for GI advantages and maybe some autoimmune issues, which usually starts in the GI. But collagen is more for, hair and nails and um, your muscles. And I would take both, if you need it. Everybody should probably take collagen, every adult. And colostrum, just take if you need it for your gut or autoimmune problems. It's not bad for you, but I think I would still take collagen. Back when I took colostrum for GI problems post-COVID, I took my collagen as well. So I'd say I'd still take it.
All right. I love that question. Thank you for sending that in over email. I see Motaz in the building. Motaz, what's going on, my brother? Great to see you in here.
Hey, Motaz.
All right.
Hey, did you hear that Dr. Oz, this is off the subject, got named in the new administration coming up for
No, I didn't.
Medicare, Medicaid services? He's going to be in the government controlling. He's going to be in charge of Medicare and Medicaid, which is great.
Really?
Dr. Oz.
No kidding.
Yeah. You have JFK that probably going to be real. He's going to shake things up.
Yeah.
I'm happy about. I really am. Sometimes it takes somebody kind of like that to really do some shakeups, which is needed. I don't agree with everything he says, but I really think he's going to shake it up for the better. He's going to make people think.
Yeah, I did not realize that about the Dr. Oz thing. That is super cool. That is super, super cool. Lots of cool things happening within healthcare. I love that, Steve. Bullish. That's right. Shelby, I see you. All right. Questions in the comments. I'm going to put this up from Edna. I want to give Edna a shout out here, getting great results with PRP. Thank you for letting us know, Edna. That's such a, that makes me smile every single time. Edna got PRP in our Bristol location with Jill Henritzi. Huge shout out to Jill. Okay, let's go to this one here. This is interesting. Thoughts on DMSO IV therapy for treatment of kidney stones. The way I understand this, Doc, is it's an IV that helps dissolve kidney stones, so you don't have to go to the ER.
Well, I've never used it for that. Whoever asked this must be reading the blogs on a Midwestern doctor, which is a blog that I get through my feed. And this guy, I don't know who he is. He doesn't like to reveal who he is because he still practices. And I guess through all the censorship and all that went on that we had experienced as well, he can't say who he is. But he's a real smart guy. He's really into both traditional and alternative. And he's talked a lot about DMS. So as a matter of fact, I read something he put out about it a week or two ago. I think Mercola also, if you follow his blogs, he talks a lot about it. But, dimethyl sulfoxide is what it is. And really it's a solvent. It's been around for over 100 years. And they use it for different things. There's not going to be any, FDA approval of it because it's all off label, except for I think the only FDA indication for it officially is for treating interstitial cystitis, irrigating the bladder for IC, which is pretty effective for. But people, claim, like this Midwestern doctor, claim it works for everything. From rubbing some on your carotid arteries to putting it on your chest when you're having a heart attack or blocked artery. I don't know, but there's a myriad of claims. I've heard of it being used to dissolve gallstones in people that their gallbladder wasn't amenable to surgery. I don't know how effective it is to dissolve kidney stones. I think it's a pretty safe thing. I've played around with it over the years, and mostly where I use it is as a vehicle transporter to get another agent in through the skin. Like if you want to use some ketoprofen or something like that and get it or put it over a joint or any kind of steroid preparation topically. You mix it with DMSO and it brings it right in. I mean, it really is very effective at getting through skin and delivering it to tissues. That's the main place I've used it some and seen it used, but they claim it does a lot of other stuff, and it wouldn't surprise me really if it does, because again, it is a solvent. You know, it dissolves things, and things dissolve in it. It comes from some byproduct of wood, I think. But so, you know, I'd probably be hesitant about giving it in my office as part of my IV therapy until I learned more about it, was really assured, because like I've always said, the poison's in the dose. So you'd have to know exactly how much to dial in intravenously. But you know, I think the hazard ratio would probably be pretty good on it.
Can
like
you say that one, hazard ratio?
Or the LD50, lethal dose, 50%. That's what we usually term any medicine. You know, what is a lethal dose in 50% of people? And usually it's way higher than you'd ever think about giving. Kind of reminds me of methylene blue, you know, which could potentially be toxic to people that are on SSRIs or MAO inhibitors. Could potentially, if you read about it, could cause serotonin syndrome. But I've never found it to be any harmful at all with those people, because you're not dosing it at the huge doses you need to have that kind of reaction. So you always have to look at the dosages. But I don't know. You know, we'll see. You know, we'll see in the future. I doubt it's going to be, you know, there's not going to be double-blind, placebo-controlled trials, because there's no money in it. The FDA doesn't like it for some reason. I think it may have caused some eye problems in rats or something back in the 60s. Don't quote me on that. But they don't like it. Usually when they don't like it, it's because it works. So, but, you know, take that with a grain of salt. So I'm not sure.
I'm going to put this up from Emily, one of our estheticians in the Johnson City location. Shout out to Emily. Used DMSO topical for shin splints due to athletics. It sounds kind of what you were talking about earlier.
Yeah, some people use it with or without something. Some plain DMSO can work too. I have some sitting up in my office that I dab on occasionally topically if I have, you know, got a little osteoarthritis in my thumb joint. So yeah, it's pretty, and using it with hemp, like Ivy's saying, asparcrine. Yeah, it makes things get into your tissues for sure. So for sure, topically, I think it works. Orally and intravenously, I haven't used it personally. So, but doesn't mean it doesn't work.
Super interesting question. Thank you for sending that in. Real quick, Doc, if you had to go ANON, would you be just Common Sense MD?
ANON, anonymous.
Anonymous. You couldn't use your name.
Is that a short for anonymous? Is ANON? Is that one of those
millennial
things?
That's internet speak for anonymous. ANON.
Oh, okay.
ANON.
Okay.
So ANON, would you be Common Sense MD?
Well, yeah. I don't mind being Common Sense MD, even not anonymous. But that's not controversial. Well, I'll claim to be a Common Sense MD because that's kind of what I try to do.
What was the one that you mentioned? Was it the Wilderness Doc?
No, a Midwestern doc.
Midwestern doc. Okay.
Yeah, he's some doctor from out in the Midwest. Is apparently brilliant, and he's really sharp. But he's afraid to come out and say what he thinks, because I guess he's afraid they'll take his license from him.
Interesting.
Especially during COVID times when they did that kind of thing.
Yeah. Super interesting. We're gonna keep moving here. Roel, can you see me? I saw your comment there. Am I out? Can you guys see me? Let me know in the comments real quick. I'm gonna put this up. Thoughts on using thermography in breast screening? What's your thoughts on this, Doc?
We use it. Yeah, we sure do use it. A couple times a year, we have Fran's sister come down from, is it Rhode Island or Connecticut or somewhere, but she's been doing it for many years. I think it's a good adjunctive therapy to mammography. I don't think it replaces mammography, But certainly, um, and again, go to my podcast on that with one of the doctors that's kind of nationally known for it. He's actually the ones that
Yeah.
reads our screens. He wrote the book on it. But yeah, I think it has its place for sure. There's no radiation. It uses heat sensors, and certainly, um, it's 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 a good adjunctive therapy. Like some women just will not get a mammogram, and that's their choice. To me, I'm not going to not treat them because of that. So I'll suggest thermography, and they're usually amenable to that. So I'm all for it. Supposedly, it picks up areas that could be suspicious years before anything else could pick it up. So um, and they use it for a lot of other screening purposes, but I think it's best used for breast tissue for sure. So I think it's a good adjunctive treatment for breast screening. I like it.
All right, super interesting. Yeah, we did a podcast on the Common Sense MD on thermography. If anybody wants to dive a bit deeper, super interesting episode. Thank you, Katie. Thank you, Motaz. I see you guys. Thank you for that. Okay, let's go to this question. Any thoughts on radio ablation for non-toxic thyroid goiter nodules?
Yeah. If it's a benign goiter, it'd have to be pretty big. You know, I just don't like radioactive iodine so much. I really don't. When you get that done, maybe you can do it for cancer as well, but for benign, non-toxic thyroid, it'd have to be bothering me pretty bad to do something like that.
Mm.
Personally, I'd rather get it taken out, surgically. But I just don't like the side effects of radiation therapy personally.
Mm.
So that's my own bias. Again, who you talk to depends on who does what. So surgeon may want to operate. Radiologist may want to give you radioactive iodine. Endocrinologist may want to give you radioactive iodine. But I'm just not big on it, personally.
That's a great question. Thank you for sending that in. We're going to go to a Cleveland question, but this came across my feed. I want to put this up. Thank you, Jeff. This is so sweet, man. Thank you for everything you do. God bless you. And man, that's so cool. That it always gives me a little teary-eyed, Jeff, when I see stuff like that about my dad. So thank you so much for putting that in there and letting us put that up. We love you, man. Thank you. All right, let's go to this Cleveland question. I, for one, am getting a Cleveland heart panel tomorrow. I'm excited. Good. The question is, I had my Cleveland done the end of August and all my metabolic scores were optimal, but my total A1C was 5.7, which is close to pre-diabetic. Would that be type 1 or type 2? And would taking berberine or inositol help? And I'll finish this out and then let you answer, Doc. I'm experiencing a lot of symptoms related to hypoglycemia, such as anxiety, rapid heartbeat, shakiness, some dizziness, and brain fog. Goes on to say what supplements would be recommended for this. 51 years old, female, and a longtime patient from the Kingsport office.
That's a great question. Thank you. But it would an A1C of 5.7, which is borderline. It's not pre-diabetes, but really sometimes atherosclerotic plaque could start being laid down when your A1C reaches about 5.7. It certainly wouldn't be type 1. There'd be type 2, which is more of a metabolic syndrome. I do like berberine a lot. Now, if you're having some hypoglycemia, that means you're insulin resistant. Usually it means your insulin level's too high. It'd be interesting to see what your insulin resistance score is and your insulin number on your Cleveland. And it sounds like you need to get something like a Stella or a Freestyle Libre to put on the back of your arm and see if that's truly hypoglycemia that you're experiencing. Because those things, for 2 weeks, and they're dirt cheap, you put them on the back of your arm and it reads your blood sugars continuously. So you want to make sure it's true hypoglycemia and not something like just anxiety that's causing it. So get that for sure if you haven't done it. Even with a normal A1C, it's more important what the spikes are doing. The A1C is just an average. So, you could be running real high and then real low, and your average looks pretty good. What's important is the spikes, either up or down. So get a Freestyle or the new over-the-counter Stella, Stello, whatever, continuous glucose monitor, and see. But I like berberine. I have had some people that didn't need to take berberine that made them a little hypoglycemic. But berberine is one of my favorites for pre-diabetes. And again, don't freak out at a 5.7. You can probably correct that just by dietary changes, i.e. lower carb. I have had a few people that were pretty symptomatic with their hypoglycemia, and I have them eat a little more frequently, especially more protein, because when you eat carbs, it goes up and down. You get too many highs and lows, but you got to kind of work it out with that, continuous glucose monitor. Everybody's different in the way their gut absorbs carbs and different things. A lot of it has to do with your gut microbiome. Certainly, I hope you're taking a good probiotic, prebiotic like Digest Shield. But we saw a lot of brain fog. We saw a lot of things for long COVID that sound like that too. So it'd be interesting to look at what those insulin resistance numbers and look at your actual 2-week results of your continuous glucose monitor. But I like that. I like cinnamon. What else do I like for that? I think hawthorn's pretty good for it. Gosh, I'm blanking out on the other one that I use a lot for that. But mostly through dietary changes that you can do. But you can try the berberine and see if that doesn't at least even you out from the highs. Because when you get the highs, too much insulin kicks in and gets you low. You may be symptomatic. Believe me, I've seen many highs and lows having been the parent of 2 type 1 diabetics. Their sugars will go from 550 to 23 within an hour without doing anything. So, look at the numbers, get some data. And the next time in your office, let's talk about it and make a plan. Some people find that if they just eat a little more frequently protein, then they feel better if they're really hypoglycemic.
That's such a great question. I know they're not the only ones, who feel that way.
Very common. Very common.
So I appreciate you putting that in through email. I'm going to put this up from Ivy. Thank you,
Cut
Ivy.
Cut out sugar.
It seems to be the first step is to get some sort of CGM. Ivy put up here the Stello that you were talking about, or the Freestyle lead, lead right there.
Those things are they're great.
Yeah.
We'll tell you all about yourself.
All right. Well, that's going to do it for the questions that came in throughout the week. Again, I can't thank you guys enough for sending in your questions. That gets the show started, the energy going. Now we're going to the live portion of the show. So if anyone has a question for Dr. Rogers, go ahead and put it in the comments. I've already seen a couple great questions. Real quick, because we're talking a ton about the Black Friday specials. I'm going to put this up from Roel. And Katie, I might need your help here. Are we doing specials on the vitamins online? Because I know we are in office, and I believe we are online, but I want to get confirmation from Katie on that. So thank you, Roel, for putting that in there. What Roel is talking about is the Black Friday special happening all week next week. You do not have to be going to an office necessarily, but we encourage everyone to call the office closest to you to take advantage of these deep discounts that we do once a year. Like I said earlier, it's one of our favorite times of the year. So much fun in the office. And what I've heard, Doc, is is there like a PJ party or something happening? I heard it was. What is this? Ask
Katie. I'm not into that. I don't know.
Is it, what day is that? Is it Wednesday? Because I need to I need to figure out what I'm going to wear.
I think that's what they said.
Wednesday. Anybody on the team can help me? Are we doing a PJ party Wednesday? Wednesday is
I hope not.
the day before Thanksgiving, and okay, I'm with you. Yes, it is. Okay, and you're joining us apparently with the PJ party. I love it. I'll have to join as well. Tabitha is going to be partaking, I believe. I love it. I think that is so cool. Wednesday. There we go. Rachel's joining in. I love it. PJ party at Performance Medicine. Super cool. I'm going to put this up.
Who would have thought? Yeah.
I'm going to put this up from Katie. It's Cyber Monday. Thank you. So Roel, the vitamin store will be doing the discounts on Cyber Monday. And I believe that is maybe December 1st or November 31st. One of the two, but we'll put that up. Thank you, Katie, for that. Cyber Mondays for the online store. All right, let's keep going here. Let's go to the first question I saw, if I can go back to it and find it. If you guys have a question for Doc, go ahead and put it in the comments. Let's see. I got Roel's. Thank you. Let's see. Sorry, guys. You guys are so kind with all these wonderful comments. Thank you for this. Let's go to Patrice. Patrice, what's up? Howdy, y'all. Howdy back to you. Easy question. Sometimes I don't know what I'm saying until I read it, but this is a great question. What are your favorite flavors of LMNT with cold water? What about the flavors of drinking hot? I feel like this is a question I can answer, which is rare.
Yeah, you need to answer that. Yeah, I don't have a preference. Maybe the citrus, but I've never drank it hot. So
I have.
So go ahead. You answer this.
Patrice, thank you. You know, and again, guys, I'm opening myself up to questions tonight too. If you have a question for me, I know Mark wants to know who my barber is. Patrice, my favorite one is watermelon. Is my favorite flavor for LMNT and cold water, and then I love the chocolate chai for the hot. And I drink that in my coffee. I love it. The chocolate chai.
Really? Does that come in the variety pack?
You have to get a hot specific one. So there's a variety pack for the hot drinks. Patrice, let us know in the comments which one you like. I'm super interested. I'm a LMNT fanatic over here. All right, let's keep moving here. I believe I am on Kristen's question. If I missed you, I'll find you. Question is, what do you recommend for leg and foot pain? Both legs. I can't tell if it's inflammation or what. Any good supplements? So this is leg and foot. What's your thoughts on this?
Yeah, it'd be nice to find out why you have it. If it's a circulatory problem, or maybe a nerve problem, neuropathy. So it'd be nice to, feel the pulses in your legs, see if you have any claudication symptoms, meaning pain in your calf when you're walking, which is usually an arterial compromise. I usually see that in smokers, so you probably don't have that. But I like to see if you have some venous insufficiency, if your legs swell, if your feet swell, if you've been on them all day. But hopefully you're not a diabetic, because it's common to have neuropathy. One thing I would tell you to take is that pain vitamin. That'd be the first thing I would put you on, that we have made for us out in Oregon. You can flash that up on the ingredients if you want. I don't know if that's available, but that is a great supplement for any kind of, whether it be joint or muscle. It's just a good herbal supplement. That's what's in it. I mean, look at that. It's got turmeric, MSM, willow bark, bromelain, boswellia, paractin, which to me is a secret ingredient, and you have to have black pepper extract when you use turmeric. So, that's a great supplement. I take it every day. It's more of a maintenance drug. So if it's any kind of inflammatory changes, that's what I would use. You're not going to get any better than that. And it's much safer to use that than it is ibuprofen or naproxen will leave, that type of thing. But if it's neuropathy, I recommend B6 between 50 and 100 milligrams. If you get too much B6, it can make it worse. So you have to get between 50 and 100. So add up how much B6 you have in your supplements. Maybe none. So those two things. So find out what's causing it and try the pain formula first, and then if it is a neuropathy, which is like a pins and needle type thing, then try B6 and see how that. But please try to find out why you have it. Interesting.
Kristen, I hope that helps a little bit. Such a great question. I'm going to go back to YouTube here for Wilma. Does ivermectin affect leukemia in positive ways?
A lot of people think ivermectin has anti-cancer effects. Certainly if I had any kind of cancer, personally, I would be taking fenbendazole and ivermectin, along with a few other things. But, probably more studies have been done on solid tumors than a blood cancer. But, I wouldn't, fortunately with leukemia, there's really good chemotherapy for it. So don't ignore that. And there's different kinds, or really 4 basic types of leukemia. So you need to, a lot of it depends on what kind you have. Is it responding? Hopefully it's a chronic leukemia, not an acute leukemia. But definitely get the traditional treatment for it first and see how it's doing. Consider adding something like fenben and ivermectin, as well as some of the other stuff we recommend that may help it, like a keto diet.
Wilma, I hope that helps a little bit. We're certainly thinking about you. Doc, great answer there. Thank you for spelling that out for us. Let's go to Stan. Stan, I'm getting to Cleveland tomorrow as well, so timely for me. But I love this question around insurance as well. I remember that Dr. Rogers told me that he used to get the Cleveland panel twice a year and Medicare would pay for it. Has this changed now, or do you have to have a special policy for them to pay? So this is in regards to Medicare.
I don't think so. I don't think so. Hopefully when Dr. Oz gets in there, it'll be a no-brainer. But yeah, I get it twice a year, and my Medicare pays for it. Again, Medicare plans are different. I always recommend Plan G. I don't like the Advantage plans personally. If you want to find out why, go to one of my podcasts on it. But not that some people won't benefit by the one of the Advantage plans, but for the most part, I like Plan G for many reasons. But yeah, they do personally for me, and probably Medicare is pretty good with that paying for the Cleveland. We do have a cash price. Certainly, if I had any kind of insurance, I would use the insurance on it. I mean, some people have just a really terrible insurance policy with like a $10,000 deductible. If I had that, I'd just pay the cash price for it, which is I think $550 or $600. It doesn't have everything in Cleveland, but it has all the stuff that I really need. So you can always do that. Although I'm not even sure if you're on Medicare, if you can even pay a cash price.
I don't think you can.
Yeah, I mean, for some reason, that's a dumb rule in my opinion. I think you should be able to pay for any lab test you want to get. But Medicare, it's one of those governmental stupid rules.
I'm going to put this up from Carter. Thank you, Carter, for this. Sometimes, depending on your insurance/supplement, it will not cover the full coverage. And again, I with Medicare, I think it's the, if you are on Medicare, it does get the most coverage out of all the insurances. But who knows? That's what we tell everybody. If we run labs through your insurance like we do the Cleveland, we don't have a ton of control over what your bill's going to be. Okay. Yep. And so no cash payments with Medicare. Katie's saying cash Cleveland $625 just for kind of an anchor for people.
For people not on Medicare. Okay.
But you can't.
Which is it's a really good price for that, to be honest with you. It's an amazing price.
but no cash
What you
payment
get.
stand for Medicare. Thank you guys for that. Okay, let's keep moving. Stan, let me know if that helps. If that doesn't, we can dive deeper. That's one of our favorite things to talk about is the Cleveland, and so we're happy to talk more about it. Okay, let's go to, I believe I'm on. Oh, I'm just going to put this up from Kristen. I'm sorry, I missed this. So Kristen was the one who asked about the foot and leg. Both the best anti-inflammatories for post-COVID flare-ups. I'm on Berberine Max, multivitamins, vitamin C, thyroid from Kingsport, collagen, vitamin, prebiotic here and there. Any more thoughts?
Try the pain vitamin.
Okay.
It's new. It's comprehensive. I like it. And if nothing else works, you may have to take my most prescribed, the one I use the most if I have to do a prescription non-steroidal anti-inflammatory, I use meloxicam because it's once a day. It's way easier on your stomach. So if you had to have one like that, that'd be the safest one to take.
All right, Kristen, I hope that helps a little bit. I'm going to go to, I saw an MTHFR question and now I've lost it. Let's see, where is that? There we go. There we go. Thank you, Jenny. Jenny's asking, can you explain what is the MTHFR and the recommended dosage of L-methylfolate you should start taking? Real quick, I'm going to put this up from Robin Riddle didn't explain this. Last year, Robin Riddle's our nurse practitioner in the performance medicine in West Knoxville. She does a great job of explaining MTHFR. So if you want to dive deeper, go to that episode on our YouTube channel. But Doc, go ahead and explain.
Yeah, it's so complex and hard to explain. You need to go to Robin's thing. She's way better at explaining it than I am. But basically, has to do with a chemical process in your body where you add a methyl group to certain substrates. And it all has to do with this methionine homocysteine cycle. You want methionine, you don't want homocysteine. So people that have that gene, and I have it myself, the double gene, I've got the worst mutation you could have on it. It's totally genetic because there's different variations of it. But definitely if you have the 677TT mutations, you're more at risk for blood clots, heart disease, miscarriages, a host of things. But so basically, and most of those people that I see, and again, we do that gene test along with the ApoE on the Cleveland panel. And so if you have the gene, we look closer at your homocysteine level, which we look at anyway, which is an inflammatory marker as important as cholesterol is. But usually people that have the gene and it's not working correctly will have a low folate level and sometimes low B12 level as well. But the three ones that you definitely need to take are methylate. You remember, take the methylated versions. Don't take folic acid. Take L-methylfolate. Anywhere from, it depends on what your levels are, from 2 to 5 milligrams of it. Take 1,000 of methyl B12 sublingually or orally, and I think it's 500 to 1,000 of the B6. But definitely start out at least 2 milligrams of L-methylfolate. Very helpful. Good to your brain too.
And Jenny, definitely check out that video with Robin. It'll go deeper into dosing and what we recommend in general. So definitely do that, Jenny. Hopefully that helps. Let me know in the comments, and we'll go back and clarify anything if we need to. I'm going to put this up from Roel. I love this, Roel. Thank you for putting this in the comments. We got the Stello and didn't have to subscribe, so it seems Stello is a subscription. One-time purchase. It's $10 less on purchase if you do subscribe. Super cool. Thank you for that, Roel. Let's get to Motaz here. Motaz, thank you for being with us tonight. Are there any tests or things to think about to distinguish kidney disease from eating too much protein and working out hard? My creatinine levels are 1.6, so it's not too bad. I think it is the protein and working out too hard, but my PC thinks it's a kidney issue. Any guidance on
This is
how
a
to,
great question.
any guidance on how to,
I ran into this twice today. Yeah, certainly 1.6 is getting up there on your creatine level, creatinine level, but you need a simple blood test called a cystatin C. Go in there and have your family doc run a CMP with a cystatin C, and that will correct for the fact that you work out and have a lot of muscle, because it's probably falsely elevated. Mine is. You'll get a true reading when you get that cystatin C of your creatinine clearance. So write that down, Motaz, and I bet you're going to be normal, because 1.6 is getting up there a little bit. Again, that's your creatinine. What's important is the glomerular filtration rate. So get the CMP with a cystatin C. If your doctor won't do it, send a note to my office and I'll send an order up there for you to get it at any lab, preferably a Quest. But very good question. Very good question.
I love that, Motaz, and I think that we've put out some content on creatine, and is that the biggest concern with creatine? Is the creatinine levels and kidney issues?
A creatine supplement will not affect your creatinine levels.
Okay. Okay.
Usually when creatinine starts rising, which is a indication of kidney problems with kidney filtration, then it's usually a result of high blood pressure through the years or overuse of non-steroidal anti-inflammatories, and sometimes some intrinsic kidney diseases. But I bet your kidneys are working fine. Get that and we'll find out.
Motaz, thank you, brother. Thank you for putting that in there. Let's see where we're at. Let's go to Kathy. Kathy, so good to see you. Is naltrexone good for joint pain? And if so, what dose?
Yeah, I love naltrexone. Low dose. Again, you're talking low dose naltrexone. We've put many podcasts out on LDN. It's one of my favorite treatments that's outside of the box. It really works, and certainly works for joint pain. We use it a lot for many reasons. I use it in almost every autoimmune patient that comes in there. And it works great for sleep. Some people lose weight on it, but it's good for any kind of inflammatory pain. So yeah, I like it. I had a patient today that was just really thrilled about it after 1 month. And usually the dose start out at 1 milligram for the first week. After the first week, go to 3 milligrams, and then if it's doing great, you can stay there. Most people end up on 4.5 milligrams. You take it at night, unless you don't like the more dreaming, which means you're getting more REM sleep, which is good. But some people, had a patient today, he couldn't take it because he had vivid, terrible nightmares anyway, and it made it a little worse. It dreamed more than he liked to, so I told him to take it in the morning. And it won't make you drowsy in the morning.
Does that mean it helps you sleep, or it just helps you get in REM?
It helps you get in REM.
Okay.
Which is a deep part of sleep. It's one of those two deep stages. And it's weird. It's so you can take it in the morning, it won't make you drowsy, but it'll probably help you sleep at night. Similar to melatonin. If you take melatonin in the morning in daylight, it's not going to make you drowsy. It only makes you drowsy if it's dark.
And Kathy's asking if it's a prescription, and I do believe it is. Okay.
Yeah.
It is a prescription, Kathy.
Yeah.
Thank you for that question. That's such a good question. LDN is one of those things that we can't talk about enough. It helps so many people. Okay, let's go to Mark here. Mark's on YouTube. Mark, thank you for being with us as always. What are your thoughts on the recent outbreak of walking pneumonia, particularly with reports suggesting that chest x-rays may be the only reliable way to detect it? In some cases, treatment ideas.
Walking pneumonia is so common, especially in the winter. If you got a deep chest cold, there's a good chance it's walking pneumonia. Some people, will do a blood test for it, but it's really worthless, in my opinion, to do that. That's after talking to a few infectious disease doctors, because everybody is going to turn positive for it that has even a cold. It's called mycoplasma pneumonia. And they call it walking pneumonia because you don't get that sick with it. You're able to walk around with it. Chest X-ray may not even detect it. You know, in my opinion, the only way I could tell somebody you have pneumonia is by listening to the chest or getting a chest X-ray. But walking pneumonia is a little different. It may not show up on a chest X-ray. And like I said, the blood test to me is worthless. So I treat it with a Z-Pack. You know, that hits walking pneumonia.
Such a great question and timely question, Mark. Thank you so much for that. Let's get to Patricia here. Patricia, so good to see you. When taking progesterone, is it always necessary to take estrogen? If so, what's the ratio?
No, that's a good question. No, you can take it without estrogen. Remember, if you have a uterus, you cannot take estrogen without progesterone. So that's a great question. And again, you could take testosterone without either one of them. But estrogen and progesterone counterbalance each other. So you want to look and see where you're at through blood or salivary test. And you want that ratio to be about 8-to-1 estrogen to progesterone. Ideally, 10-to-1 doesn't bother me, but around 8-to-1 is the ideal. And again, remember, it's going to change if you're still cycling, but for postmenopausal, you need it. For example, when you're in your early 40s, mid 40s, your progesterone falls out way before your estrogen does. So you lose that counterbalance, so you get estrogen dominant. That's when you get fibrocystic breasts, uterine fibroids. Too much estrogen is not good for you, male or female. So you want progesterone, and usually going to start it early. So the typical case is I'll start the progesterone, and that starts dropping out in the 40s. And it may be 5 years before you need any estrogen. So, and if you're cycling, sometimes I'll just use progesterone the last half of the cycle. So get the levels checked, and if you are cycling 28 days, then try to stop in and get your blood test between day 19 and 23 in that luteal phase. That's when I prefer it.
Patricia, thank you so much. That's such a great question. I know that's helping more than just one person, so thank you.
Love progesterone. I take a little bit of progesterone.
Yeah. Speaking of that, we're getting ready to go into. I'm always fascinated. We head into the winter months, and I know you take 5FU. Speaking of things you take throughout the year, I'm interested as the conversation goes to the 5FU stuff. I think that's really cool. Just thinking about the stuff you take. So I know that was completely random. But thank you, Patricia, for teeing us up there with progesterone. Let's go to Megan. Megan, thank you so much for being here. What supplements do you recommend to help with long COVID symptoms?
Of course, I love LDN. LDN is my go-to. We've been using that for many years. And it's interesting. I was reading an article a few months ago in the Wall Street Journal. They always have great health articles in there. And this one was talking about long COVID. And the Stanford Long COVID Clinic has started using LDN as their preferred choice for long COVID. So certainly to stick you on that really fast. I still use a lot of ivermectin for long COVID symptoms. I like to make sure your vitamin D is good. You're taking vitamin C, you're taking zinc. And a lot of it depends on what kind of symptoms you have. If you have brain fog, which is the second most long COVID symptom behind shortness of breath and fatigue, brain fog. And for all that, I love methylene blue. Methylene blue. And look at our podcast on that. It's tremendous. So probably my two favorites would be LDN, methylene blue, and then maybe ivermectin.
No, I love that. And for those who we get questions around this, I'm just going to put it out there on our website. It's NeuroPro Plus. On our website's the capsule version of the methylene blue, but we can't talk about it enough. It does so many cool things. Megan, I hope that helps. Let us know in the comments. I see Robin Riddle's in here, our nurse practitioner in the West Knoxville office. So good to see you, Robin. Can't wait to get to hang out here in the next couple of weeks. Her ears must have been perking because we were talking about your.
We've been talking about her a lot.
your MTHFR video that was so good. If you guys want to know more about MTHFR, go check out that Explain This episode with Robin Riddle. Robin, thank you for being here tonight. Okay, let's go. Where am I at? I believe I'm at Roel. If I missed somebody, let me know. Roel is saying, Doctor, would niacin supplement help with triglycerides?
It's better for cholesterol than triglycerides. What we use for triglycerides is more the omega-3s for natural supplements. And I like niacin. Sometimes I use it instead of statins. I'm not as hip on statins as most doctors are. I use them rarely, but niacin is a great way to lower your cholesterol, and it has a lot of other benefits as well. Vitamin B3. The problem is it flushes everybody. And a lot of people will take their first dose over the counter at 500 milligram. They'll go to the ER because they think they're having an anaphylaxis to it. They get really red. So we have a little protocol that we use for people that I want to put on niacin. You start out with 100 milligrams. It's hard to get. We stock it. You take that at night with your 81 milligram aspirin, and sometimes even a little bit of applesauce. For some reason that quells it down. And then advance every 4 days by another 100 milligrams until we reach a gram. Sometimes I go up higher than that, but that kind of eases it if you do flush, plus you sleep through it. That's a good little way to get niacin on board because that is the most common side effect. A lot of people just don't tolerate it very well. Great question. So omega-3s for your triglycerides, and then when we do the Cleveland, we check all your fatty acid balances, and we'll see what your omega-3s look like. You have to take a fair amount of it.
Roel, thank you for that, man. It's a great question. The niacin, I love when you give the niacin strategy, because I know that's one thing that scares a lot of people from it. So there is a strategy around taking that. So thank you for explaining that. This is my sister's here. Kelly, I love you so much. Thank you for joining us on the show. I know you don't have to, and you do, and I appreciate you. I love you so much. The question is, I'm afraid to get blood work because I don't like fasting for too long. Why should I fast for blood work? It's actually a really, really good question.
A great question. It's just traditional. When you fast, we always kind of look at the fasting blood sugar, fasting cholesterol, really, and triglyceride. Cholesterol is not so much affected fasting as you would triglycerides. They're kind of, they'll pop up when you're not fasting. But really, to be honest with you, I think a non-fasting lab is, as long as I know when I'm going over the results, it's a non-fasting lab, actually probably gives me more information than a fasting lab. So I don't freak out about it. I never turn anybody away for lab work because they've eaten. I just want to know if they've eaten, because a lot of times I want to see how high that insulin level pops up. I want to see what those levels do. That's why we use a CGM to check blood glucose. It may be great fasting, but it may be 200 after you eat something, those mashed potatoes or something. That's why Kelly likes the cauliflower mashed potatoes.
There you go. That's right.
Kelly's one of the best people I've ever seen with her diet.
She eats super well.
She doesn't eat out much.
Super
she
well.
does great on her diet.
Kelly, thank you for this question. It's a really good one, and I'm glad you said, Doc, that the big thing here is to tell the phlebotomist, tell the nurse, tell the doctor, that you were eating or didn't eat. And because that's the main thing is
some people just don't like to fast. They won't need something on their stomach, so they won't pass out when they get their labs. So I'll say, fine.
It's a great question, Kelly. I love you. Thank you for being here.
By the way, Kelly, a lot of that damage on my arms that you lasered off is really clearing up.
Oh, that's cool.
I'm going to have to get Kelly to do a podcast. I had a lot of sun damage on my arms from sunburns, playing tennis in the years, and certainly had a ton of damage. That's one reason you talked about the 5FU.
Yeah.
And that's a cream that I use along with calcipotriene that will get rid of those AKs. I do it in the winter because it really kind of blisters you up a little bit.
Yeah.
But the calcipotriene really helps quell that down a little bit with getting the same effects. But Kelly's got this laser that's this cool laser that really does not hurt at all and really works really well. I'll probably get some before and afters out through Kelly. But if anybody's got damage on their hands, sun damage on their aging hands and arms, see Kelly for that. It's an amazing treatment.
Yeah, and a quick reminder: the winter is the time to take care of your skin, and that's why what you said with the 5FU and with these laser treatments. I see Emily's in here. Yes, cool peels. That's right. The winter is the time.
They can make your skin look as smooth as a baby's butt. Is that right, Kelly?
I love it.
We're not supposed to say that butt. We shouldn't say butt on the air, should we?
No.
We may get censored again. We could get censored for that. I'm
Kathy,
hoping with this new administration we won't get censored as much, Ben. Are you hoping for that?
I'm hopeful. I'm very hopeful. Kathy, Kelly's in Johnson City, the Johnson City office. Thank you for that, Kathy.
That's amazing.
I want to put this up from Shelby and make sure we get to this one. Shelby, thank you for being here. Shelby saying something to take for a lot of hair loss. And I see in the comments there, Shelby, that you're already taking Happy Healthy Hair. So it's other stuff. So something to take for a lot of hair loss on hormones, but my stress level from work is also very high. And she's already taking the Healthy Happy Hair. It's a great question.
Yeah. First of all, get your blood work to see what your thyroid's doing, your cortisol stress levels are doing, your iron levels. We check all that. A lot of people have hair loss for hormonal reasons. In general, hair loves estrogen, does not like testosterone or DHEA too much. We saw a lot of hair loss with COVID, post-COVID. But definitely the vitamins are a really good one, but you're probably going to need some minoxidil, oral minoxidil, not Rogaine topical, oral minoxidil. And if you're not childbearing age, I use a really low dose of finasteride, which is a DHT blocker. So that's the perfect triad, really, that I use for that. Sometimes I even do PRP treatments to the scalp to get it going again. But yeah, stress can cause hair loss. There's no doubt about it. So look at your hormonal levels and see where make sure you have adequate estrogen for sure.
Shelby, that's a great question. And keep us posted. Let us know how it's going, because I can tell you're not the only one who is dealing with that. And Kathy's asking, does that help with men's hair loss? I'm assuming, Kathy, you're talking.
Yes.
Yep.
Sure does. All of it.
Amazing. Guys, I believe we got through all the questions. If I didn't, I promise we'll get it on the next week's show. But I think I got through them all. Let me know at the end of the comments if I did, if I missed you. Doc, this was amazing. Guys, we have so many people on our team here in the comments. I love y'all so much. Thank you for being here after a long day at the office. You guys are with us tonight. Thank you so much. Let's go. Okay, real quick, Doc. I want to get Jennifer, and then we're gonna rock out. Jennifer, thank you for being here from Florida. I was diagnosed with Grover's disease. What do you recommend for that? They say it's worse if you sweat. Prescribed steroid cream doesn't really help. Any thoughts on this, Doc? This is interesting.
Yeah, that's a really unusual disease. It's almost an autoimmune type thing. You itch, you sweat. You may have to go on a short course of steroids to see. But I would look at, the other thing I would do is look at your gut microbiome and make sure you don't have a lot of gut problems. Get on something like Digest Shield that will calm down that, at least balance your microbiome, meaning good bacteria, bad bacteria. And, look at those things. Look at your stress levels. Look at your cortisol levels. Low dose naltrexone may help that. But yeah, that really requires a workup of your immune system and your gut. And there's some things you can try for that. You may have to occasionally go on like a steroid dose pack, but I love LDN in cases like this. Look up low dose naltrexone.
Jennifer, we've done a couple videos on LDN. After this show, look up LDN or low dose naltrexone performance medicine. It'll all show up on YouTube. I hope that helps a little bit. Thank you for putting that question in there for us, Jennifer. Guys, how'd we do? We do okay. I see Cherry's giving us a 10. Thank you. D-Len's a 10. Thank you. Doc, this was amazing, man. I thought this was such a great show. The people who are with us live, you guys just make this so much fun. We appreciate the questions. We appreciate the interaction. The Tom, thank you, man. You're the best, Tom. I appreciate you, man.
Do they appreciate the witty banter that we do? The witty banter between you and me.
I think we've got great banter. You know, like
nobody thinks I'm very funny.
I think
Young people think I'm not funny. You don't think I'm funny?
I think you're hysterical.
Katie and Carter think I'm dull as a rock. But I think I'm funny. You know?
I think you're hysterical. You know, like your
hair jokes. You know,
your humor does not show your age at all. Your humor is very young.
I don't know what that meant.
Guys,
fun.
Thank you, Motaz. Thank you, Carter. Thank you, guys. To everyone on our team, we love you so much. Thank you for being here. Real quick, I'm going to end with this. This is Black Friday week, or the eve of Black Friday week, I should say. I'm going to put this up and leave it up for you. Take advantage of these specials if you're a patient or want to be a patient. These are the deepest discounts of the year. We have our Emily and Kelly's in here, skincare and aesthetics is in here as well. Vitamins. Thank you, Katie, for the comment around the Cyber Monday. The online store will be on sale. But this is happening all next week. So if you're around in office, take advantage of the discounts. Pop, I love you, man. Who do we got? We got
Ike here.
There's Ike. There's Ike. Ike, happy early Thanksgiving.
We see it Thanksgiving, man.
All right, man. Love you.
Good night. Love you too.
All right, let me see where my outro is. Hold on one second. Outro. Thank you. Hold on. I got to put this up for Mark. For Dad won't see it, but I'm going to see it. Look at this. I think I could do it. A roadie for Motley Crue. That would be incredible. That would be incredible. I love that. Thank you, Mark. I love you, brother. All right, guys, we're out. We love you. We'll see you next week. Tuesday, 7 to 8, we'll be back. Black Friday week happening all next week. Take advantage of the specials. Until then, where's my outro? Brad, come on, Brad. Where's Brad at? There we go. See you guys.
Don't go away.
Yeah, we're still on. Hold on. Where's my